looking good is just not about appearance. It's about feeling confident in your own skin. Hi everyone, welcome to Storymakers. You all know that Storymakers is about a show where we bring to you people who are bringing a lot of change in the society, and with their story and their story of success and struggle, we get to learn a lot. Here we have with us today yet another story maker. He is doing extensively making people look good not just from outside but also from inside. He's taking care of the science of skin and of course the science of beauty. We have with us Dr. Gaurang Krishna, who is the co-founder of MedLinks. He is a dermatologist. He's also the hair transplant surgeon, doing so much. Now let's just hear it out. Let's hear his story. Hi, Dr. Gaurang. So good to have you here.
Thank you.
So first of all, let me know, how are you feeling today?
I'm feeling all right. Excited to be here. Excited to be on your show, and as a story maker, it really is a proud feeling. Thank you so much.
We know that you are already a change maker. You have your own story, but like we know that everyone has a story of hair and skin. All of us have, somebody has good hair, somebody has a good skin. Now you being a person who's brought about a lot of change, how have you brought, or rather been a story maker in somebody else's life? Probably your patients.
So my job as a dermatologist, as a hair transplant surgeon, is not just to make people look good, but also to enhance and restore their confidence. Because see, most of the issues that we deal with do not hurt. They are, they don't give you pain, but they are concerning you. They concern you socially. They have an impact on the patient's confidence, and that's where we come in. So yes, in that way, I'm blessed to be a story maker, a life changer in many people's lives. One really interesting story that I still remember is from my AIMS days, from 2007. This young girl from Bihar, came to our OPD for some white spots.
Okay.
Little bit white spot, not major problem. And my thesis in my post-graduation was about the psychosocial impact, the psychological impact that vitiligo, the white spot disease, has on a patient. In fact, I had developed a questionnaire on that. So I was interviewing that patient, and our consultants, our professor said that no, she does not need a lot of treatment, to send her back home, give this cream. But when I talked to her, I realized how concerned she was about treatment, and really demoralized, really lacking in confidence, because white spot in our society is not considered a very good thing, and particularly for a female, and not a very nice thing to have. So I insisted my professors to get her admitted, and we put her on long-term treatment called ultraviolet therapy, which was not needed medically, but I thought it was needed psychologically. She spent around 1 year in Delhi, and that really restored her confidence. We could not make a lot of difference in her disease, but we made a lot of difference in her confidence. We gave her the belief that she's doing something about her problem. We made her believe that there's somebody looking after her to make her problem. And then when she went back home, she was a different person altogether from here. So that is something, that story is very close to my heart, and I would still want to keep doing such work and bring change in people's stories.
That's such a great thing to hear. And like I told you, Story Maker is, the show is about how you are changing and bringing change in people's life, and how beautifully you brought confidence to her. Now it's all about skin, hair, everything. Like I said it before, it's just not appearance, it has to be confidence. We also see here in today's time, there are a lot of claims that we see, a lot of ads that say that, that you happen to grow new hair, like about 20,000 new hair in a couple of days or something. Is it right? Is it true?
No, so this is the biggest lie going around right now. Take this vitamin pill or apply this magic serum and get thousands of new hair within 3 months. There's nothing like that. It's impossible. Everybody knows it's impossible. You would know it's impossible. We definitely know it's impossible. The person making the ad knows it's impossible. But there we are. We have that dream selling going on. So I urge the people not to fall into that trap. It does not hurt, maybe a few thousand rupees, but still, it really shakes up your belief in the system, in the science. So don't fall into that trap. There's nothing like that grows new roots. It's impossible. And you can take care of your hair if it is already there. But if you have lost your hair, lost your roots, then it can't grow back with serums or vitamin pills. So no, it's not possible. Fortunately, a reporter like last month only told me that Indian government has taken a cognizance of these fake ads, and very soon they're going to crack down on these dream sellers.
Oh, great. So we've got a great news here. People, don't fall on for such ads. Please go to the right person to have that right guidance, because it is not a miracle. It takes time. It's a science. It's a science. We know that, beauty is, everybody would like to look gorgeous, beautiful, and our great influencers are our celebrities. Now with that, women of all ages want to look, even if you're getting older, like about 50 years plus, they still want to look like they used to look in their 30s or maybe 20s. And for that, you are there. You help us, look beautiful, skin work. But we've also heard, like recently we've heard there was a celeb who also was going under this treatment and she lost her life. Now, we would like to know, how is it? Why did this happen?
So see, so there's a old saying that anything overdone, anything which is good but overdone can cause problems. So I think the same happened in that particular case, because these IV drips, the skin fairness and skin glow drips have become hugely popular. And when something is extensively used, it is very easily abused also. And I think the same thing happened, because the problem in that case, as so far my knowledge goes, is that the injections were given when the person was in a fasting state. She was on a 2 days fast, and still those injections were given. So important information for people who do get these glow drips is that these glow drips have a thing called vitamin C, and vitamin C reduces blood sugar in your body. And if you are fasting, your blood sugar is already low, it goes further, and it's called hypoglycemia. And in hypoglycemia, heart problems, cardiac arrests may happen, and probably the same thing that happened. So if you are undergoing any kind of IV drips, do not ever take it on a fasting state. Have your proper meal and then take your drips, then you are in a safe zone. So these things are good things. These are popular, frequently used treatments, but have to be done in a certain way with a certain protocol. Safety cannot be compromised for beauty.
Absolutely, absolutely. And we never knew that this could be the reason. And she lost her life. That was very, very unfortunate.
No, it's crazy. It's crazy for something so routine like a IV drip. Somebody undergoing cardiac arrest is very unfortunate.
All right. So, Dr. Gurang, we know that you're a hair transplant surgeon. I wish you were a heart transplant surgeon also, like your father wanted. Now, with that, what I would like to know is, hair transplant is different for different bodies, for different heads, or is it like the same thing, एक ही तरह का treatment रहता है?
नहीं नहीं, ये this is not right. A hair transplant is totally customized. It's a customized surgery, right? I have been doing hair transplant since almost 15 years now, more than 15 years now, and every day I find a new challenge, that this is a different kind of hair, this is a different kind of skin. So hair transplant is totally different. Whether it comes to planning, the hairline design, different kind of face shapes need different kind of hairline designs. Different kind of hair. We get blonde Caucasian hair, we have North Indian black hair, we have South Indian curly hair, to African totally kinky, like totally curly roots. So every hair transplant is different. We use different tools in different hair transplants. So there are things like punches, there are things like micromotors. Not one equipment is used in every patient. For every patient we have a different kind of equipment to give them the best outcome. So yes, a hair transplant is not one size fits all treatment. It has to be customized depending on the need, age, profession, what kind of hair the person has, what kind of skin the person has, what are his or her expectations from the treatment. Based on that we make a treatment plan. Based on that we use different kind of equipment so that you get the best possible outcome.
All right. So, and the same goes for the skin?
And skin even more. So hair transplant is again one kind of surgery with variations, but in skin there are so many variables. Somebody has a dry skin with pigmentation. Somebody has an acne is an oily skin. The treatment is easy, but some people have dry skin and acne prone skin. The treatment becomes difficult. So what kind of face washes are to be used, what kind of moisturizers are to be used, whether they are to be used or not, it's there's lots of permutation and combinations when it comes down to skin. It's not that, okay, take this face wash, everybody take this face wash. No, the skin has to be tested. What kind of moisture level is there in the skin? What kind of pore size is there? What's the age of the patient? What's the age of the skin? And based on that, there has to be a treatment plan. So it's all, skin is next level permutation combinations.
We know that you have beautified a lot of celebrities. You're working with celebs.
Yes.
Now, first, how does it feel to be working for them when they come to you? Because they're at a stature. Now, when they come to you, how does it make a difference to your life?
No, so medical. So first of all, the feeling is only of gratitude, because there have been certain celebs which we grow, which I grew seeing them performing and patronizing them and idolizing them, and then when they came to me for their treatments, then it's a different feeling. And the feeling is all of gratitude, thanks to the Almighty, thanks to my parents, thanks to my patients, and thanks to the celebrity who decided to come to me. So the feeling is of gratitude. Treatment wise, it's the same. Treatment wise, we do not make any distinction whether it's a layman, whether it's a aam janta, whether it's a celebrity, whether it's a politician, whether there is a business tycoon. Our treatment remains the same. But yes, feeling does differ. Like when Viru Bhai Viren Sehwag came to me, so I always say that I had three feelings running. One is of a doctor, of course, which is there. One is of a true hardcore fan, and one is of Indian. He's national property. Viren Sehwag is national property. So those three feelings were running. So that was kind of a bit different. When I cater to a patient, the feeling is of a doctor. It's not of a friend. It's of a doctor. But when a celebrity like Sehwag comes, then fan, I should not hurt him. Everything has to go right. He should be feeling very good. We have seen batting him and thrashing bowlers. So that fan moment came, and of course, he's an Indian celebrity. Nothing wrong should happen with him. So that national feeling was also there. So that's the difference. You take some extra care, but again, there is a law in medicine called Murphy's law. If you want to take extra care, if you see that nothing should go wrong, the wrong happens there only. So yeah, 10% difference when we treat a celebrity.
So, there is any moment in your life where you also have had that fan moment?
No, so yes, fan moment happened with Viru Bhai. Big time fan moment happened, and recently with Matthew Hedden. So again, I have grown up hitting Matthew Hedden, like literally hitting him, because he has the best of the records against India. So and when the Australian team was at its peak, when Matthew Hedden, we lost the World Cup 2003 World Cup because of him, and we have lost so many matches because of him. But when he came for his hair transplant with us, the fan moment was there. I told him that you have hurt us a lot. Now this is our turn to hurt you a bit, but it will be less. Don't worry. But yeah, that was like really nice when he came to us. Yes.
Okay, if I, it's a little out of the box question. If I happen to give you somebody from Bollywood, who would you like? How do you resonate? Or maybe who's that celeb which you feel that your life resonates with his life? If you have anyone.
Okay, so again, I would give two answers to this. Resonation wise, I would say Shahid Kapoor, because the reason is because he's from the industry also, and like an outsider also.
Right.
Because Pankaj ji, his father was not totally inside Bollywood. He was a veteran actor, but not totally inside Bollywood. So Shahid Kapoor had an edge, but had to make his own niche. He had to work very hard, and the way he has done is fabulous. So I also come from a medical background, from a doctor's family. So I had that edge. I had the means of getting the training done, and I have seen the family how to treat patients, how to treat. But in this industry, aesthetics industry, and at a large scale, this was something new. And again, God has been grace. We have been able to carve out a niche, just like Shahid. So I would resonate with Shahid Kapoor. What I would look up to, what I want to become, somebody like then SRK, Shah Rukh Khan. The way he has done it and still doing it is fabulous. From a complete outsider, from a struggler, to at the top of everything. So if I can be 10% of that, I'll be very, very happy.
He is an icon of his industry, and I'm sure so are you of your industry. You are, of course, making a lot of difference to people's life, and that makes you somebody who stands out. Dr. Gaurang, now that this was kind of an industry, this Bollywood very attractive in industry. Now coming back to where you belong, you founded with your, like, you're a co-founder, you, two of you friends, you founded this MedLinks, and you incepted this in 2013, right? Quite a time. How's this journey been?
So it has been a very, again, the feeling is of gratitude, and the journey has been uphill only. uh, Thankfully there were not much of roller coasters. Journey has been nice, smooth, uphill. So though we started in 2013, the conceptualization was done in, I think, 2008 or 2009. So when we were at AIMS, and we were seeing that we are giving the best treatment, but in a setup where people struggle to reach that to reach that point, that yes, they have finally come to AIMS and getting their treatment done. It's a difficult, back in the days, it's still smoother now, but back in the days it was quite difficult for Aam Janta to reach AIMS and then get treated. I've seen people, waiting for days to get their number, get their card done. So we decided that why not, and at our time, the trend between us postgraduates was to continue at AIMS, be at AIMS, be senior resident, then professor, and just live your life in AIMS. But then me and my partner, so we decided that why not bring out the quality and honesty of AIMS and ethics of AIMS treatment to a private setup. And that's where MedLinks was conceptualized, and we finally started in 2013. Very humble beginnings. We still remember that we used to go to Bhagirath Place. It's a place in Chandni Chowk, and carrying all the medical equipment ourselves because we wanted to save money, and carrying big bags on a rickshaw back to the clinic, to now where we are. So brick by brick, MedLinks was, as I told you, very humble beginnings. But we built it brick by brick. We expanded it brick by brick, and now very soon we are going to have a clinic in Dubai, which will be a good achievement for us. And we are one of the most popular skin and hair clinics, not just in Delhi but across India and across the world, I would say, because people come to us from across the world for their surgeries, for their treatments. And we are very proud, and we are very grateful that we got this opportunity, and we are still expanding, and we want to be the number one skin and hair clinic chain in Asia.
Superb. So you started humble, you're growing, you have long way to go, you're spreading your wings across the world. But still, if I see here, you said that MedLinks is doing wonderfully well, and I really bless that it happens throughout your life. But if I see here across, since beauty is at the rage, we also see beauty clinics are at the rage. You see every nook and corner, every time there is a announcement of one clinic opening. Why and how does MedLinks stands out? Why should I come to you?
It's a good question, and we also asked the same question to us. Why should anybody come to MedLinks? So the answer to that is that we are not a business. We are still a clinic. We still, that seva bhav is still there, and we want to continue with that. We are doctors at core, not businessmen. So just profit, just numbers, P&L statements do not bother us that much. Our priority, not priority, our only focus is patient welfare. And whatever we earn financially is a byproduct. So what we want is to give them quality. As I told you, the whole pillar of conceptualization of MedLinks is to give that AIMS quality, scientifically, skill wise, honesty, and ethically wise. So honesty, ethics, and science, these are the three pillars of MedLinks, and will continue to be so. So why you should come to MedLinks is because you will get, number one, ethical and honest advice. If any treatment is needed, you will get the best skill of best brains, best doctors of India. You will get the best technology, and at a fair price point. So everything together is what we are striving to give our patients, and I don't think this will ever change. Whether we are expanding or whether we are not expanding, these core ethics will remain there, and your welfare, your patient's welfare is our only, it's not the priority, it's the only thing that we are looking for, and whatever else happens, name, fame, money, it's all a byproduct. So if you come to us, be assured that you will be in safe hands, you will be in honest hands, most importantly, and we'll do the best possible that as per our limits to heal you.
Such a great thing to know here, because I know people have this concern of pricing. Of course, honesty is one of the most important thing here, because there are times people come with very dark issues, right? And how you keep them confidence That's also important. And like you're saying, these are the pillars that MedLinks is standing upon, and you're keeping that. And for the audience, I think they would fall upon a person who would, give them comfort, uh, treatment, and of course that trust that I am there and I help you. Now that I know, with that nature of yours or that instinct of yours, you're also a wellness coach. Like, you're also, taking your journey, you're plunging into this journey of being a coach. How does this start? Like, how have you started this, and how are you making difference to people's lives?
So see, I was always into fitness since my college days. But then when I came into private practice, when MedLinks happened, my personal fitness took a backseat, and we were working. Diet went haywire, and I have a long family history of everything possible: heart disease, diabetes, hyper blood pressure. Everything is there in my family. And I just once randomly tested myself. I was testing my father for his diabetes, for his sugar. I also tested myself. My fasting blood sugar came 180, and I was shocked that finally diabetes has happened. But I was only, I think, 35 or 36-year old when this happened. So that's why I thought, no, this is not right. Just work and just eating whatever you want and all these things. This is not the way to live. You have to take out time for yourself also. And that's why I went back into my fitness regime. I started getting up early. I started exercising. I started watching. I'm a bunny. I'm a hardcore vegetarian. Everybody is vegetarian in my so, and that too predominantly carbohydrate diet. So I consciously changed my diet. I started eating eggs. I started eating less white carbs. So I took care of my diet, and that really helped me a lot. So the way you are seeing me today, 3 years back I was not this way. I'm still fat, but I was much fatter then, and the blood work was haywire. Thyroid was coming borderline. Blood sugar was high, and blood pressure was getting high. Now everything is under control just by a disciplined lifestyle without any medication. So I thought that if I was able to help myself, and I have a medical background, I know about medicine, I know about health, that why not give it to my patients also, my friends, my family also, my circle also. So that's why I'm now working on giving holistic health to people, not just taking allopathic medication, not just depending on, like my father. I've seen my father being dependent on insulin shots all the time. Beta kha liya, dose thoda sa, let's take 2 units more. This is not the right way of doing it. So now I want to educate people about what they should eat, how they should exercise, how to have a healthy lifestyle. If you are suffering from diseases like diabetes, hypertension, blood pressure, thyroid, sleeping issues, obesity, then how to achieve a balanced life with minimum medication. That is where we're trying to help people. And I am looking forward to a very exciting journey in this phase of my life, this path of my life as well.
No, when you say that you were not this 3 years back, it comes as a surprise, because you touch wood that you look into like a pink of your health, and I cannot even imagine you fat. You're not fat. You're fit.
I still want to have a long way to go. I still have a certain goal in my mind. But yeah, 3 years back, this was pretty bad, pretty bad.
But then you took over, like, until it comes on to your own self, you don't change. Now then you changed yourself, you want people to change.
Yes, and
That's a great thing, and that's why you're being into the wellness industry again. I am sure you're going to make big in that also.
I hope. I mean, and that will not be my profession. It will just be a passion.
Oh, wonderful.
Always. Yes.
Yeah. So, like we were talking about, like the lifestyle and all. At present time, we see that people are stressed. Now that I know your dad is a doctor, he's conscious, but of course he also got infected, right? And it's the stress, pollution. However, you try to be fit, the atmosphere is such, and you get infected. And when it comes to skin, your skin bleeds because of this. How do you, as a doctor, would like to recommend things? What kind of a regime one should follow, like for all the men and women, to be away from the, like, you are stressed, it's okay, your skin shows, okay, pollution hai, okay, fine, take care of this. What are those tips that you would like to give?
So, Chika, these are the perils of living in a metro like Delhi, where air pollution, water pollution, noise pollution really take a toll on your health. And your skin, being the largest organ, that's the barrier of your body. Skin is protecting your internal organs. This is the first thing that takes the brunt of all this pollution. So that's why these days, and I think you will agree with me, problems like acne, hair fall, pigmentation, dry skin, allergies has really increased in last 10 years, has really increased a lot. And not just in older population, in young population also. That is because of all the allergens that we are exposed to. People are getting more and more allergic to pollens, to dust, to smoke and smog. The water is not of the best quality, it's all treated water, so people do get very rough, dry, brittle hair. People do get skin rashes very, very easily. So the simple things that you can do to prevent that if you're allergic, if you're in a place of very high pollution, extremes of heat, your clothing should be appropriate. So I would say if I'm allergic to insect, like kids are very allergic to insects, so we advise them to fill full sleeves clothes, full sleeve shirts, full sleeve clothes, so that you are directly protecting your skin from outside allergens. It's always a good practice to hydrate your skin. So oil your skin with coconut oil or with a moisturizing lotion of your choice. Not just hydration, it also acts as a physical barrier. Your allergens, your pollens will not enter your skin that easily. There is a barrier. In fact, there are certain medical creams that we give as a medical barrier, so that the allergens, that things that are irritating their skin, cannot enter the skin so easily. So after, it's a good habit that after bath, apply a thin layer of oil. Coconut oil is my favorite, or whatever you like, so that your skin is hydrated and acts as a barrier also. Avoid using too many chemicals, particularly when it comes to hair. People really like using hair gels, hair waxes, too much hair coloring and stuff, which is okay once in a while, but overdoing it without protection is damages your hair quality. So use milder products, use milder shampoos or milder soaps, which are not that damaging. They do not strip off the natural oil of your hair. So this is something that you should do. And again, oiling your hair, not scalp. So oiling is for hair, not for scalp. So oiling your hair once in a week, twice in a week is a very good practice. It really protects your hair shaft from these allergens and pollutions that's there. And hygiene, absolutely important. People very proudly say, I shampoo, I wash my scalp once in a month. It's a very good thing. No, it's not a very good thing. So just like you wash your face every day, maybe twice a day, you should wash your hair and scalp also very, very frequently. My advice usually is at least 2 to 3 times in a week. That's minimum. And if you're sweating a lot, if you're into sports, or your scalp is very oily, then daily shampooing with a mild shampoo is totally all right. So it's a myth that I want to break, that too much head wash causes hair loss. There's nothing like that. So hygiene is absolutely, absolutely important.
Wonderful. So much that we've got to hear. Of course, everybody knows to keep yourself hygienically well, but I had no clue that we can also wash every day, because if you go to salons, they always say that, ma'am, please do not, you happen to lose the moisture of your hair. But here, of course, there are a lot of things that I'm getting to know in the episode. Now we have very a different session here. It's called a rapid fire. No, it's not coffee with Karan, but yes, we'll have a this thing. Now, on a very quick note, I would like to know, hair or skin, what's harder to fix?
Hair is much harder to fix.
All right. Miracle product or disciplined life?
Disciplined life. Absolutely.
One celeb with the best hair.
Shah Rukh Khan.
One common mistake people make with skincare.
Excessive use of sunscreens.
All right. Transplants, it's a science or art?
Subtle signs, major art.
All right. Confidence or looks, what matters the most?
Confidence, confidence, only confidence.
And your story in one line.
My story in one line.
Difficult?
Difficult. Exciting. Yeah, exciting and full of gratitude.
Wonderful. What a great thing to know here. And towards the end, I would like to know, you are an entrepreneur, you've been into the journey, you're not just a doctor, of course, you're running a clinic. Where do you see yourself 5 years from now?
Yeah, so yes, I'm a doctor from heart and from soul. I'm a doctor, but yes, I'm an entrepreneur also. 5 years from now, as I told, our goal right now, personally, my goal would be to have MedLinks as the #1 skin and hair clinic chain of Asia, not just India, and to give affordable and quality skin and hair care to masses. This is not just for celebrities. Skin and hair care, looking good, should not be just for rich people, not just for tycoons. It should be for everyone who wants it. And that's our goal, to give affordable skin and hair care to every Indian.
What a great, great thought. I would really wish you from my heart that you achieve success. You've already been achieving, but of course, there's this, let's we say it this way, that sky's the limit. So, very best to you, Dr. Gaurang, and thank you so much for being here on Story Makers. You made a lot of change to other people's story as well. Thank you once again.
Thank you, Simran, for having me here. Thank you so much.
Thank you, dear audience. I'm sure you've liked this show, you've liked this episode. Please do let us know how this episode has changed your life. We are looking forward to your response. This is Simran, your host, signing off. But with a promise, we are coming back with yet another super personality. Stay hooked.